Hello, I'm Dr. Diana Chavkin at HRC Fertility in West Los Angeles. A lot of people throw around the term patient focus, but I will say that patient focus really is my true approach to patient care. I was a fertility patient myself, went through this process, and to me, when I went through it, I know what it's like to really want your doctor with you every step of the way. And when I was a patient, that was how I felt, and so that's how I try to take care of my patients. I listen to my patients in terms of trying to understand what their goals and objectives are, in terms of what they're interested in, how many children they want, what approach they want to take to get there, and really take that into consideration when writing out a treatment plan and coming up with protocols. I try to make it individualized for each patient. I also make sure to be there for my patients every single step of the way. So for all of their ultrasounds, all of their visits, all of their retrievals, any sort of procedure that they're going to need, it's always me every time holding their hand every step of the way. And I really try to put their kind of emotions and their hopes and their dreams kind of at the center of every step of the way of their medical care, to make sure that really the whole patient is taken care of, not just one aspect of their medical care, but their entire approach is taken care of by thinking about all of the aspects that they are interested in. As a doctor who's practiced infertility for many years and a patient who's gone through fertility treatment, I think I have some good insight into this. So one thing I would say is it's really crucial to work with a clinic and a doctor that you trust. And it's trust on many levels. It's trust from an emotional standpoint. It's also trust from a medical standpoint. I think that it's important to feel like you have a doctor that's available to speak with you throughout the process when issues come up or when concerns or questions come up. And it's also important to feel like your doctor is really involved every step of the way to make sure that things don't fall through the cracks, and that your care is excellent by having your doctor really on the pulse of things. And you want to make sure that, when you, at the end of this process, that you can feel comfortable that you've done everything you can to make sure that things can work out in the way that you had hoped for. And the only way to really do that is to know that you are with a clinic and a doctor that you feel comfortable with. I also advise you to be up for the roller coaster. There's no way 100% to know how things are going to work out. And sometimes when things are potentially a setback in the immediate course of things, it doesn't mean that in the future there won't be another up, and that setback might actually be something that might be beneficial somehow in the future. And you just kind of have to be up for the ups and downs of it all. And it's hard to predict. I also encourage you to look out for emotional and social support, friends, family. A kind of most obvious thing is that building families is just the absolute honor. I think for anyone in my field to feel like you can help to improve people's lives by helping them to create the families that they dream of is just really just the utmost honor. And there's just nothing better. There's no better feeling. On the other hand, there's also something really amazing about being there for people through the downs as well. So, it's like I said in the prior question, there is not always a straight path to success. There are sometimes ups and downs, and of course the ups are amazing. And sending people off with their pregnancies is a amazing feeling, but also to be there for people when it's difficult, but to still have them feel that they're getting the care and that they're in someone's hands who's giving them the best chance possible is also extremely gratifying. And it's just such an honor and a privilege to be there for people throughout this process, and for people to allow me to be there through such an intimate and such a vulnerable portion of their lives and their journey.